Good morning and welcome, nonprofit changemakers. I'd like to start off with a quote by Phil Wohl. Don't ever feel like your best days are behind you. Reinvention is the purest form of hope. Make today your best yet. Even amid a global pandemic and civil unrest across our country, there is hope. There is hope for courage to engage in the national, state, local, and personal conversations around racial equity and justice. Guidance that so many of you are desiring every day as we realign our missions while redefining our physical workspace. Hope for understanding through the connection with leaders who are making decisions to keep us safe and healthy. And lastly, hope for the realization that reinvention requires all perspectives and viewpoints, and that we are better together. We have a great session planned today and are thrilled to be able to kick off A New Way Forward, Reimagining the Nonprofit Workplace Virtual Engagement Series. Today's session includes a conversation involving myself and other CEOs from our host organizations who will be introduced shortly. Together, we will be discussing planning for the re-engagement of paid staff and volunteers, highlighting key considerations in people-first decision-making that is grounded in equity. We are honored to welcome Governor Gretchen Whitmer, who will start us off by discussing her administration's efforts around reentry. Our session concludes with legal advice to consider in developing a reentry plan, including an overview of Michigan executive orders that impact nonprofits returning to their workplace. Now for some important housekeeping. This webinar is being recorded. The recording and slides will be shared afterward. We have built in time for questions and answers. All participants are muted, so please use the chat function to ask your questions. As you know, the information around COVID-19 is moving at a rapid pace, and the situation is ever changing. We are all doing our best to understand and apply what we can. This context is important to express as we begin today, as our presenters plan to share guidance which should not be construed as legal or financial advice. The upcoming series session, this is the kickoff for the series, and upcoming sessions are now on the screen. Now, I would like to introduce my colleagues. Alondra Bulger is the Executive Director of COAC Detroit. If you're unfamiliar with COAC, it is a 6,500 square foot space to connect nonprofits to resources and accelerate collaboration between organizations. Alondra is an innovator, a builder, and one of the most thoughtful leaders I know. Please welcome my colleague and friend, Alondra Bulger. Welcome, Alondra.
Donna, thank you so much for that welcoming introduction. As Donna mentioned, I have the honor and privilege of serving as the inaugural Executive Director of COAC Detroit. And we're super excited because we're actually about to reach a pretty significant milestone. 1 week from today, we will celebrate 1 year of having our public launch, which kicked off our programming in the space that Donna spoke about. And while we are a relatively young initiative, we are the manifestation of several years worth of best practice research and wisdom and insights from both local and national leaders. Through our programming, we really work to accelerate collaborative action in Southeast Michigan. And we do this in a few ways. The first is by meeting nonprofits where they are and co-developing programming to help them address their needs and move their missions forward. The other is that we work really closely with partners across the region to create a more resilient and connected nonprofit ecosystem. And then lastly, there's our 6,500 square foot space, which, like many of you, we are in the process of reimagining and thinking about how we evolve that space for our use as a team, but also for the broader community. We have a small but mighty team, which means that everything that we do is done in collaboration with others. And so it's my honor and privilege to welcome my friend, my co-conspirator, Shamil Dobbs from Michigan Community Resources. She is a colleague, a thought partner, a brain trust, sometimes therapist. And if you looked up the definition of composed leadership under fire, you'd likely see Shamil's face. Shamil is embarking on her 3rd year as CEO at MCR. And in that role, she is gracefully navigating being a stay-at-home working mom, while also ensuring that an organization that is critical to frontline nonprofits in our community has the resources and tools that they need. So welcome, Shamil.
Good morning, everyone, and happy Friday, and welcome to everyone joining on the phone. And thanks, Alondra, and thanks, Donna, for that introduction. First and foremost, organizations like ours are collections of people. I have the distinct pleasure of leading a team that's comprised of lawyers, social workers, community organizers, creatives, entrepreneurs, and honestly, we approach this from the heart. We do this from a space of recognizing that the sector, and that's nonprofit organizations, community-based organizations, Block clubs, really need quality capacity building services. So from that space, we lead a variety of different programs, from our traditional pro bono matching, where we connect nonprofits to attorneys. And we're also working with a number of different philanthropic entities to really roll out their initiatives and ensure that, again, nonprofit organizations have again, access to the things that traditionally they may be lacking. So we're excited to be in this space, and I'm excited to be here with all of you today. And just a quick note, I'm going to be lifting up and introducing Courtney Kissel later. She's an attorney that is going to be presenting some incredible information for us later. But in the meantime, I would like to introduce a colleague and a good friend, Kyle Caldwell. Kyle is an amazing person. Michigan philanthropy, volunteers, nonprofits, donors, grant makers. It has been his vocational home for more than 25 years. He started out as a public grant maker and has led every nonprofit sector infrastructure organization in Michigan, which is incredible. With that background, Kyle is astute in several areas, including public and private partnerships, service and volunteerism, and in effective grant making and public policy. Kyle is a strong believer in community philanthropy, and 3 years ago, he began doing 3 distinct things. And I think all of us can learn from this. Thing 1, he listened. Thing 2, he listened. And thing 3, he listened. So with that, I think all of us can turn to Kyle and do some listening and hear what he has to say. Welcome and good morning, Kyle.
Good morning, Shamil. Thank you. I really do feel like the thorn between a bouquet of roses here. So thank you for that great introduction. And I can't think of a greater panel to be on than this powerful one. And to really talk about not only the work of nonprofits, but really the ecosystem that we all live in. And I'm proud of the fact that I get to lead a junior partner organization, the Council of Michigan Foundations, that is a community of philanthropy in Michigan, representing over 85% of all endowed assets in our state, and an organization of 300 truly committed leaders who are thinking hard about how we build effective philanthropy throughout Michigan to benefit all our residents. The Council of Michigan Foundations has a long partnership with the Michigan Nonprofit Association and even our newer partners here at the table to talk, and have been working to talk about what does it mean to be part of a community of philanthropy, nonprofits, grant makers, volunteers, all of us who are in our community, and what is our leadership role. The Council of Michigan Foundations is a 48-year young organization that really stands in a leadership partnership role throughout the state, including with our friends in government. And I think that is amplified as we talk about this conversation here, that we all believe that business, government, and the social sector have important roles to play. And this is a great opportunity to continue that. I can think of no other person who I've personally known who better exemplifies this multi-sector approach than the person I'm going to introduce here, a fellow Lansing Community College champion. I'm an alum. She's a former administrator there, Paula Cunningham. Paula Cunningham is, I could only describe as a champion of community and business and education. She's been a leader in Michigan for a number of decades, and I'll just say that she started out in elementary school. She's recently been more recently, her role has been as state director of AARP in Michigan, championing the policy and roles and important space that our seniors play in our community and in our lives, and also been a staunch champion of how we make communities more open and acceptable to our seniors, and focused on those who are thinking about encore careers. Before coming to AARP Michigan, she was a leader, faculty, and then moved up into the leadership of Lansing Community College as its president. Under her leadership, the campus grew in a number of different ways, including establishing a West Side campus. At the time that she was appointed, I think it was the 9th largest single campus community college in the nation, and she did nothing but grow it from there. Paul and I also worked together when she was the CEO of Capital National Bank, and if I could think of anyone who had exquisite timing, it was Paula, who joined the bank in 2006, and in the midst of that, helped the bank navigate growth through the Great Recession. I can think of no better role for someone who is a change maker than to be in the middle of a financial institution during a financial crisis. Throughout Paula's career, she's been actively involved in numerous community government organizations, including serving as the chair of the Michigan Nonprofit Association. So you can imagine what it's like for me as a trustee of that organization to have Donna as its CEO and Paula as its chair. It's a tremendous organization. Paula's also involved with a number of other organizations, including the Michigan Association of United Ways, and has been also the co-chair of the Children's Leadership Council of Michigan. That is a fraction of her bio, so I think I've thoroughly embarrassed her enough, but I think I've also provided you the context to understand what a great and tremendous leader and asset she is for Michigan. So thank you, Paula, for leading us out today, and I'll turn the program over to you.
Thank you, Cal. I think my intro from you was longer than the governor's, so I appreciate. You forgot that I was chair of the first grade RIF class as well. But at any rate, I appreciate you, and what a blessing for all of Michigan to be able to call you a resident and a friend of so many throughout our state. And welcome to the distinguished group of panelists that we have here. In addition to serving as your moderator for the second half of this session, I am absolutely honored to introduce our governor. Gretchen Whitmer, she is a lifelong Michigander. She is a lawyer, educator, former prosecutor. She was a state representative and senator. She was the first woman to lead a Senate caucus. However, the most important title that she boasts is that of mom. Inspired by her family, she's devoted her entire life to building a stronger Michigan for everyone. Governor Whitmer was elected to the House of Representatives in 2000 and elected to the Michigan State Senate in 2006, where she served as Senate Democratic leader. In 2018 gubernatorial election, Governor Whitmer won all 83 counties in the primary and won the general election with 53% of the vote. Since taking her oath of office, she has put together the most diverse cabinet in our state's history, and has signed executive directives to clean up our drinking water, end discrimination in state government based on sexual orientation and gender identity, secure equal pay for equal work, yes, and expand opportunities for small and disadvantaged businesses. Governor Whitmer is committed to solving problems for Michiganders every day. That means ensuring every Michigander has a great public education and a path to a good paying job. and that every community has clean, safe drinking water, and everyone can drive to work or drop off their kids at school safely without blowing a tire or cracking a windshield. Remember that slogan, fix the damn roads? Born and raised in Michigan, we are honored to have Governor Gretchen Whitmer join us. Please give her a virtual, warm Michigan welcome. Governor Whitmer, thank you for being with us today. Would you like to make a few comments now?
Yes, thank you so much for having me. I am so glad to be with you, Paula, my dear friend, but also all of you. I'm so been looking forward to this opportunity because I think the work that you're doing is so important, and I really appreciate the hard work that you do on behalf of our communities, especially during times of crisis. And I know that a lot of our foundations are working hard to supply food and water and supplies for families who need them. And nonprofits often work on the front line, essential services, and that work has been especially crucial over the last few months. The work of our nonprofits has helped our front lines like PPE that they need to protect themselves and their families. And I've seen so many good people across the state who are taking this time to help others. Volunteers who are passing out food to families, healthcare workers on the front lines, grocery store employees working around the clock to keep shelves stocked, teachers who are still taking time to reach their students in new and creative ways, and parents who are just trying to keep their kids entertained. There are superheroes that walk amongst us every day, and we see them in times of crisis. Our nonprofit work is critical, and that's why throughout this process, I've ensured that these services, the executive orders that I've had to sign during this crisis, have consistently recognized nonprofit work as essential or critical infrastructure. And I've worked to ensure our nonprofits are at the table to help make major decisions with the Racial Disparities Task Force and Return to Learn Advisory Council to get our kids back in schools when it's safe to do so. Your voices and your input are very important to me, and I want you to know how much I appreciate the work that you've done throughout this pandemic. I know that you're rethinking your workspaces to deal with COVID-19 and to keep your employees safe and the public that you serve. Many nonprofits have seen a drying up of charitable donations that they rely on due to economic uncertainty because of the crisis. Our charitable sector employs about 470,000 people and more than 1 million volunteers statewide who provide critical services. And the financial hardships on these organizations have enormous impact on the state's workforce and our economy. So I recently signed Executive Order 2020-114, which continued requirements for businesses to develop a plan that's consistent with OSHA guidance so we can keep our workers safe. Going back to work is going to look different for a little while. We've all got to continue taking safety precautions while we're in the workplace to protect ourselves and our colleagues and our families. We've got to maintain a 6-foot distance when we can and wear a mask and washing our hands. There's no question we have come a long way with our experience with COVID-19, but we are not out of the woods yet. So I'll closely work with our nonprofit sector when working to address the systemic racism that we're confronting as a state as well. George Floyd's death has held a mirror up to our society and reminded us that we've got a lot of work to do together to build a more equitable state. And that means working to ensure communities of color have access to quality schools, healthcare, affordable housing, transportation, and much more. And it means ensuring there are seats at the table for people of color in our businesses and nonprofit. And I know that everyone on this call today shares a commitment to diversity within our organizations. Our nonprofits play a critical role in helping communities of color. And my administration is working to develop a close relationship as we work to address this problem. Again, I just want to thank everyone for your hard work as we've navigated this crisis, and the Council of Michigan Foundations, Michigan Nonprofit Association, Michigan Community Resources, and Co.act Detroit for putting this series together. Michigan has emerged as a national leader in slowing the spread of COVID-19. We're the envy of 48 other states, but now is no time to spike the football. We've done great work, but we've got to continue to stay vigilant and take care of each other. So stay smart, wear your mask, practice social distancing, and we're going to get through this together.
Thank you so much for those remarks, Governor Whitmer. We appreciate all that you are doing and really appreciate your time with us today. We do have some questions from our attendees, from our participants, and I've seen you in front of congressional hearings, so I know you're no stranger to questions and you handle them very, very well. So let's get right at it because we know our time is limited. One of the first questions that we have is from someone who wants to know, one of our participants has asked the following. As we plan for the future, if another outbreak occurs, God forbid, can we expect the same stay home, stay safe executive order requirements? And what are some of the indicators you will look for to inform this decision?
Yeah, well, thank you for the question. I think it's really important. I know it's on everyone's minds. Early on, we took a number of aggressive actions to flatten the curve and protect Michigan families from the spread of COVID-19. After the first positive cases were discovered on March 10th, we moved swiftly and closed school buildings to Michigan students, limited public gatherings, and ultimately issued a stay home, stay safe order to slow the spread. Throughout the crisis, the majority of people in our state have done the right thing. They've taken it seriously and they've stayed home. Those who've done their part, especially the brave men and women who continue to be on the front lines, have helped us push this curve down, and there's no question we have saved thousands of lives in this state. A new report released by the Imperial College COVID-19 response team shows that these actions have protected families from the spread of COVID-19 and significantly lowered the number of cases and deaths. So stay home, stay safe has undeniably worked, and it's because the people of our state did the right thing. Now, the report shows that as we announced the order and other measures to combat the spread, the rate fell. And now we're in a really strong position where we're re-engaging our economy. While we might not be unanimous in every step that we've taken to get here, I know as a state we are unanimous in the fact that none of us, including me especially, wants to ever issue another stay home, stay safe order. So to avoid that, we've got to keep our guard up. We've got to keep wearing masks and take this seriously. We have to continue building up our ability to do testing and be able to trace where COVID-19 is spread and to isolate cases so that we don't have community spread. If we do all of those things, we'll continue to be in this strong position. But the data that we're looking at is how many tests a day we're able to conduct. And we still have supply chain issues that we're hoping the federal government will fix once and for all. We are building up our tracing capacity. We built up our stores of PPE across the state. We are in a much stronger position than we were 10 weeks ago because we built it. And so the data points that we look at are numbers of positive cases, how quickly we can identify where they are, what the context is. And Dr. Janae Khaldun has done a phenomenal job as our chief medical executive. And we're going to stay close to the science. We're going to continue to communicate and do so with honesty and transparency so people know what we're in store for. But we've always been very clear, if we see uncontrolled growth happen, we may have to, dial back. And I think in the final analysis, our ability to continue moving forward depends on all of us doing our part. And I know that everyone on this call has taken that seriously and done your part, so I'm grateful. But we've got to keep watching that. We'll continue to share information as we're seeing things play out.
Thank you so much for that response. Second question is around partnerships, Governor. And partnerships have been key for many nonprofits during this pandemic. And we see daily where nonprofits are working with other nonprofits and sectors like corporations to continue to help people in communities. How do you see partnerships between nonprofits and state governments helping communities?
So I think that there are unlimited ways that we can further partner to help communities. And I'll just say this, I can't tell you how grateful I am for the work that you have done and the partnerships that we've already explored. It has inured to the benefit of countless Michiganders. We cannot do this alone. So partnerships between nonprofits and state government have really been integral through this crisis. My team's been working closely with our nonprofit and foundation leaders to improve access to essential needs like food and water throughout the crisis. And I'm excited to support the supplemental agreement that we negotiated with the legislature that includes items like $9 million for food banks in our state, which will be used to help families in need. I think we've got to be aggressive when we fight a virus, but we've got to be creative as we figure out how we can harness the resources that we have. They're not unlimited, but together we can make them have unlimited impact.
Thank you for that response. Thank you. We appreciate that. Our final question, before we know your schedule is extremely busy, but our last question is our series, this series has launched today, and it's not only about reinventing the nonprofit workplace, but also doing so through the lens of equity. As a matter of fact, the next part of the agenda will bring together some really powerful nonprofit leaders to share some insight on that topic. Will you please tell us more about the Michigan Coronavirus Task Force on Racial Disparities, which I know is led by Governor Garland Gilchrist, and how this might be a resource for nonprofit leaders who are looking at their work through an equity lens?
Absolutely. So, one of the things that I think proves out how important it is that there is true representation at tables of power, whether it's in the corporate world or it is in state government, is that Dr. Caldwell, who is an African-American emergency room doctor, is our state medical executive. She has been my right hand as we have navigated this crisis. And she was the first to say we need to release racial data that we are collecting in association with our COVID-19 tests, because it is profound, the impact that COVID-19 is having on communities of color. When 13.6% of our state is African American, and yet 40% of our COVID-19 deaths in Michigan are African Americans, that is startling. And that was precisely why we thought it was so important to educate the public, to really have a focused effort to communities of color about the unique risk of COVID-19, but also to focus on equitable opportunity. And that's why I created the Michigan Coronavirus Task Force on Racial Disparities, which is chaired by our state's first African-American lieutenant governor, my other right hand, Garland Gilchrist. As our lieutenant governor, I think it's important that we are showing the leadership where there is a vacuum on the national level, to be frank. And I also want to acknowledge that we were one of the first 3 states to release this kind of information. Illinois and Louisiana were the other 2. Members of our task force consist of leaders across state government and healthcare professionals from communities most impacted by the spread of coronavirus. And the task force provides recommendations on how to address racial disparities in healthcare concerning COVID-19. So members of this task force are regularly gathering feedback from within impacted communities, and nonprofit leaders who are interested in the task force are encouraged to participate. We welcome that partnership. The Michigan Coronavirus Task Force Community Action Team, we'd love for you to participate in that. So there's more information on the Michigan Department of Health and Human Services website, or of course, we are connected directly if you want to work through the executive office. We recognize that the challenges we face are great, but the strengths that we bring to the table when we stick together and work as a team are more than up to this challenge, and we'll get through this together.
Governor, thank you so very much. On behalf of all of the Michigan nonprofit sector, we appreciate you being here today. We appreciate the work that you're doing. We know you are extremely, extremely busy, so to give us any time at all is very much appreciated. We hope that you stay safe, stay encouraged, and maybe get a chance to enjoy this beautiful Michigan weather that we're having right now. So again, we appreciate you, and we're going to move into the next part of our session. Thank you, and everyone who's listening, I know you can't see, but let's just wave and give the governor a wave thank you for all that you're doing, and appreciate you. Stay encouraged.
Thank you, Paula. Take care, everyone.
Thank you. Appreciate you. All right, ladies and gentlemen, we are now going to move into the second part of our program. And joining me now are the phenomenal CEOs who are from the hosting organizations, and they are getting ready to share some insights as we look at how we're going to reinvent the nonprofit workplace. So to begin, we have a question. All right, so here we go. The series is called A New Way Forward, Reimagining the Nonprofit Workplace. because it is intended to be about much more than just preparedness plans, work plans, but rather centered on people-first decision-making, grounded in equity. So the question is, what does an equity-centered nonprofit workforce and workplace mean to you as employers and as nonprofit leaders? And let's see, Shamil, Kyle, one of you want to take that one first?
Absolutely.
Right.
So again, good morning, everyone. And first off, let me just say happy Juneteenth to everyone. It is an amazing day, 155 years in the fight for Black liberation. So I think it's important that as we think about equity, as we talk about equity, I just want to ground us in what today is, what it represents, and also the fact that, as we all know, I mean, we have thousands, more than thousands of people taking to the streets, protesting across our country, protesting across our world, really capturing the heart of what's happening in terms of injustices in our nation. And as we think about our leadership and as we define equity, I think it's important for us to understand that as we ground the conversation in equity, we can't talk about equity without recognizing and appreciating the inequities that exist in our country and in our sector. It's everything from obviously the overlay of race, racism, economic disparities, access, systemic barriers, and all of the fights for justice that are happening, not only in our sector, but again, quite frankly, across the country. And I would encourage all of us as we're thinking about an equitable approach, not only for reentering the workforce, but quite frankly, in service of our mission. Step one is to look internally at our organizations and really ensure that we have equitable practices from within. Those conversations that need to happen, obviously, with our staff, with our board, thinking about, again, the frameworks that we may have in place that capture the spirit of what needs to happen to break down the barriers to access for communities that we serve. And again, it's also the diversity of the communities that we serve. There's not a one-size-fits-all approach for the sector. We have nonprofit organizations that have traditional office spaces. We have nonprofit organizations that are working in the community context. So understanding all of those pieces as we work together to sort of break down those barriers, I think, is critical. Kyle?
Thanks, Ms. Shamil. I would only add just a couple points to your brilliant synopsis, and that is, as employers, we and CEOs of nonprofits, we have a responsibility to create a context for safe places for conversations around equity.
That's right.
I think for us, this has been the most meaningful and challenging time I've ever been in our sector and been honored to be at the head of an organization, because we now stand here in the midst of a pandemic, which is a public health crisis, an economic downturn, and in the midst of a national reckoning of our original sin.
Right.
And all of that becomes our responsibility, not to solve alone, but to create the context for people to move our mission in those directions, think about our work, but think about creating the safe place for that dialogue. And so one of the things that I've been thinking about, in this people-centered approach, in the midst of a social distancing environment, is that I've been able to identify a struggle. And that struggle is, we have before us the most intimate of problems, the most hyper-connected of resources and tools, as we're doing right now, but the least opportunity for intimacy if we're not careful.
Yeah.
And so creating that safe space for intimate dialogue, trusted places, hard issues, bringing in facilitators to help think about the work. I'm constantly reminded too about over-communicating about returning to work. One great example is, we were wrestling with this idea of, as a membership organization whose spring is spent face-to-face intimately with our members. We just came off our most intimate event, Foundations on the Hill, and then shut everything down. And how do you maintain that purpose in engaging your members without putting your members or your staff at undue risk. So how do you
Absolutely.
build that intimacy? And I think what we've been able to do through these hyper-connected technologies is create those safe spaces. And we've had dialogue with our members that I don't think we would have had in a face-to-face meeting. And part of that is, how do we go back to work? How do we ensure our member safety, ensure our staff, and ensure that we're still fulfilling our mission? And
Yeah, and I appreciate, sorry, Kyle, I was just going to quickly say, I appreciate you saying that, but I think what's important to note and lift up is, even as we're framing hyper-connected technologies, there's a huge technology gap for many of the nonprofits that we serve and that we work with. And I never take for granted, again, the privilege and access that we have, that our office in particular, Michigan Community Resources, we were able to send our staff home with laptops and cell phones, so that the minute we had to plug into a virtual world, we had access to the tools to do so. But recognizing that the groups that we serve may not have similar access. Or what if your internet goes down? Or what if you don't have internet? Or what if you have to tether from your phone just to have access to these technologies? So, there's layers to all of it. And my apologies, I know you were in the middle of a thought, but I really wanted to lift that up.
No, I'm glad you did, because that's exactly the next point, which is that we have all of these tools. We have all of these tools, but not everyone does. And one of the things that we had to do was check in with our team right away to see what's your access, right? How do you do this conversion? But then create safe spaces by allowing children to run in the background, to allow for disruption, to allow for people to have personal lives, and then create empathy for our work and people who are affected. So a lot of our focus right now has been really focused on, how do you deliver education differently? Because we're assuming all of these tools are available to every child and every parent, and they're not. And not only are they not available, but they're not available in a way that might ensure an equitable, high quality education. And so I think, even as we think about not just returning to the workplace, but what are the personal lives of our staff and our employees and the people that we serve, and how does equity play into the return to work? Because our tolerance, our empathy has to be dramatically increased. And I'll be honest, I'm still learning. I step on it all the time, making assumptions.
Yeah, and I'll just note for the 200 plus folks listening, I have quarantined my own children upstairs in their bedroom so that they would not be a distraction to this call. So perhaps my kids are not feeling the empathy, but the love is there. They have food, they have all of the things that they need. But to your point, Kyle, I think all of those considerations are equally important. And I know that myself, Alondra, Donna, others on this particular webinar, we've been talking about return to work. And I just recently made the decision alongside my staff and my board that, on a personal level, MCR, we would not be physically going back into our office space until after Labor Day, for all of the reasons that you lifted up. Childcare, right? The fact that summer programs for many have been canceled, and their parents are figuring out how to balance space and time in work. I think the other piece of it is also just recognizing that we have the privilege to be in this remote setting, and we can operate our mission in this moment. But again, as we're talking about equity, and we're talking about equity centered, and even this concept around return to work, there's also the recognition that some nonprofits have not stopped business as usual. There are folks that have been working. They have returned. They've actually not gone anywhere, right? When you think about organizations that are providing basic human services, whether it's housing, whether it's food, all of the things that we think about in this moment that are exacerbated by a pandemic within a pandemic, there are organizations operating in that space. So as we frame, again, equity, and as we frame the conversation around return and how to do things that center our people and keep our employees safe, I think it's important to note that, again, privileges are not the same across the board.
Agreed.
Thank you.
One last point that I just want to make.
No, please, go right ahead.
And I know we're over time, but I think the other thing, Shamil, that you and I agree on, that we need to sort of center and ground in our equity conversation is that there are things that we have been putting off doing for our employees, that this is the time to transform. So we had a number of members use this opportunity to go back and ask, what do their staff really need? What are their nonprofits that they support really need? Asking the question, what does help look like for you as you go back? And we've had members sort of look at, for example, their college tuition reimbursement program. And is this the time to really rethink that? Because time and investment in them could look differently now. And there's an equity lens that you could apply to that for staff, that it's not about the time in which they've served with an organization, but it's about what they need. So is it college debt relief? Is it advancing their education going forward? So all of those internal policies that we've been sort of holding off to the side, this is the time to re-examine those as you think about going back to work, to create more opportunities of flexibility and investment in your team. So I just wanted to say that one thing, Paula. Thanks.
Absolutely. Through every crisis, there are opportunities if we seize those opportunities. Outstanding comments of both Kyle and Shamil. I heard someone say that COVID-19 shone a light on inequities or reality, but actually it's shown a light on false realities, right? Things that we kind of buried our head and didn't think didn't want to admit were going on. So I like the national reckoning phrase that you used, Kyle. The next question, and thank you for these questions, but the next question is, what are some of the immediate, shorter term key considerations that are top of mind for you as you think about reentry for your own employees, and how might those same considerations be applicable for nonprofits on this call today? And let's see, Alondra or no, let's give this one to Donna. Donna, you want to start on that one?
Oh, sure. So I think
Alondra,
actually, I'm going to ask Alondra to weigh in on
her hand on that one. Yeah.
Yeah, absolutely.
Sure, absolutely. Thanks, Paula. So many considerations, right? For COAC Detroit, when we opened our doors a year ago, it was really about creating a safe and accessible physical space, literally, to bring folks together, to share ideas, to learn together, to problem solve together. And what we've learned over the last year is that space, that has been about building community and has been about creating these critical interactions and connections, has had a huge impact in a very short period of time. And so you can imagine that, as a team, from how we're working to the way we're delivering services, we've had to completely reimagine and rethink about that work. And so our team, like many others, is working virtually at this time. I think, I'll preface my comments by saying that because we are in a space where uncertainty is so prevalent, we literally don't know what's going to happen moment to moment, that the need for flexibility in decision-making and processes is utterly important. I think there seems to be an eagerness in our broader society to reopen just about everything, and a rush to return to the hypothetical normal. But I think, we really need to focus on what's right and not just what's popular. I don't think the answer is to rush back into the way things were, nor to embrace the quickest or easiest path to reentry. These are complex and nuanced decisions, and there are very real considerations from a programmatic and an operations standpoint. But the highest priority has to be the health and safety of people. You have to put people first. And for COAC, that includes our team, that includes the community we serve, and all who engage with our space. And so we allow our values to sit front and center in that decision making. And, we're obviously consulting the official positions of state and federal public health agencies, and review reentry not as a one-time event, but as an ongoing process that will be informed by the context of, what's happening in our society and our community, but also including our staff in the shaping and decision-making of what this reimagining looks like. But I'll echo the comments of Kyle and Shamil by saying that if we are taking an equity-centered approach to reentry, then that means we start by centering what's needed by our team members and the people we serve who may be at higher risk of contracting the virus or developing complications, and ensuring that we don't put them at unnecessary risk. I think it also means that we are taking into consideration that everyone is experiencing different realities outside of the office, some of which have already been mentioned with childcare, even as we embark on the summer and summer camps reopen. And, like there's a apprehension, right, on the part of a lot of parents, and rightfully so, to return their children into daycare and into those types of environments, as we're still learning so much about what's happening. So even as we re-enter the workspace, it may require us to continue to implement flexible work schedules, right? And again, empathize with our teams and understanding what their individual situations may be. We have some team members who rely on public transportation. When you think about how that's been impacted from a social distancing perspective, that something as simple as getting to work could pose a significant risk. So these are some of the things that we need to consider in terms of the immediate and short-term decision-making. One of the things that we're working on right now is, thinking about what it means to re-enter our space as a team and have visitors and volunteers in the context of social distancing, right? And so, it's a challenge, but it also poses a huge opportunity for creative thinking. For us to reimagine how we engage. And a big part of our value is, again, co-creation. We, try not to create things in a vacuum. We partner with folks on this webinar. We look nationally to see what other folks are doing. And so I think as nonprofits are exploring what reentry looks like, so many of us are trying to figure this out, and I think that's key. This, to me, is an opportunity for amplified peer learning and sharing, and an opportunity to really source our own collective wisdom to apply the tools that may be working or not working for folks that we may be working with.
Yeah, I appreciate your comments, Alondra. So many people are waiting to get back to normal, and it's never going to happen again. That's just simply not going to happen. I don't even know what a new normal looks like. None of us do. Cal, did I see your hand up? Did you want to make some comments on that as well?
Just real quickly, that the this value-centered approach, but also as leaders, we have a legal responsibility. We forget that a lot of what we're talking about are OSHA rules. So creating the next level of safety in the workplace, all of this plays into that. So we have this legal responsibility and we have this ethical responsibility, finding itself at the same time. And so, for us, it's figuring that out and then realizing we kept thinking of ourselves as a storefront organization. We're not a storefront organization having 4 offices. We're a convening organization. So what does that mean for us, and how does space amplify that? And the final thing I think we all have to kind of think about as we think about immediate short term is because we're in the midst of a crisis, we forget that there are creative collisions that happen because of proximity that you may not get this way, just bumping into each other in the hallway. So we have to think about how you create those creative collision opportunities.
So we have a minute or so before talk about space. Anyone talk about a little bit more about space and how you create those creative collisions. How does that happen when you're not in the same space, and how do you co-create? Someone want to just talk about that? Just don't all raise your hand.
There are a couple of thoughts that just listening to my colleagues. So just to directly answer your question, I think we have to create those creative collisions. And so some organizations I know are creating space outside of work designated as perhaps a happy hour or a convening of sorts that are interesting ways of learning about each other, I think, in a more intimate way that has been missing. So I know we at M&A have had the opportunity to show different spaces in our homes that people never would be able to have the opportunity to see. And so what it does is be able to share like your personality and something that people may not know about you, about your hobbies, or something that's very special about you. So creating those kind of unique opportunities are things that we've been doing, and I've heard that along with some other members and other colleagues in the field, just trying to create those spaces that don't necessarily exist. I'll ask my colleagues if they want to weigh on, because I want to bring another point up, if I could, around the short-term things that we should be thinking about. So I don't know if there are any other creative ways of creating those creative collisions. Shamil?
The only thing that I would offer is that we've been giving a lot of thought to non-digital tools as it relates to organizing, while still maintaining obviously safe practices, and really thinking back to what did we do before, webinars and all of these web-based tools, phone trees and calling people on the phone, and really just paying attention. I think right now necessitates an extreme intentionality to just pay attention to people and what's happening in the world, and reading and understanding. And those creative collisions, I think there are several creative ways to do it, but there are just old school traditional ways to do it that are sort of that human to human connection that we can still maintain in this moment while creating safe opportunities and space for our staff. So I just wanted to lift that up.
Absolutely.
Thank you, Shamil. And Donna, you had another point?
Yeah, so one of the things I want to just to lift up, and it might be relevant for some of the people attending today, is that, this reentry, especially if we're talking about coming back in September, I do know that there have been a lot of organizations who had to either furlough or permanently reorganize their organization. And so when you come back, it is a very different culture, because you're missing maybe some key people or people that actually represented the culture of the organization in a way that you really don't know until you reassemble yourselves. So I just want to say that that is also that sense of loss that people might be experiencing by not being able to work alongside of people that they did before, because you had to make necessary decisions, or that was best for the organization in the way that you were able to deliver your programs and services. I wanted to lift that up, that's happened in the short term, and there are implications obviously long term for that, but just recognizing that is happening. The other piece too is that this is such a dynamic time with having a global pandemic and an economic crisis, and just the opportunity to re-examine racism in our country in a way that we haven't been able to do before. Like this, all of this convergence of all of these big things has our colleagues, as our employees, our teams going through lots of different emotions. So how they felt March 15th when all this started and what they're feeling now has changing. So you can't take this point in time survey and say, how are you feeling? If you even did that, right? I suggest that we have to really make sure that we're having these consistent touch points with our colleagues, with our team members, because as I think someone mentioned already, that everyone's experiencing different realities, whether it's their personal reality or even with how they show up at work. And we have to be prepared as leaders to understand that people are experiencing many different emotions, many different things through all of this, and that it's not static. And we can't say we checked it off when we checked in with them. We have to continue to do that and figure out ways to connect with one another.
Excellent, excellent points. And as leaders also, we have to find a way to release some of our own emotions, because we've got to show up every day helping other people. And so to all of you, I just encourage you as well. I mean, you're not just the leader, your mothers, your sisters, brothers, fathers, whatever. You've got to find that release for you as well, so you can continue to lead. Thank you so much. Let's go to the next question. And the next question says, looking ahead, yes, what are some of the longer term implications of re-entry? What opportunities do you see for the nonprofit sector, and what can nonprofits be doing or thinking about now to prepare for those opportunities? And I know, Donna, you touched on that a little bit. Do you want to expand on that a little bit more?
Yeah, so yes, I would. Thank you. I think one of the things that we all should be thinking about as leaders is that this experience that we're having right now kind of stopped us in our tracks, and we started to really re-engage differently in the moment. But the long-term implications are really back to our original culture of who we are. So it's not enough to be able to say, well, now I'm doing this because a result of COVID-19, I'm checking in with my colleagues. And you might be checking in with your colleagues and you receive either blank stares on a Zoom call or you don't get the feedback. It may be because your organization is a very rigid organization at the start, right? It might be that you don't have the organizational culture that you really think that you have. And so that will come back to roost if you're not dealing with it holistically, not just dealing with what we're dealing with now, which is utterly important, the short-term piece of it. But there might be some real cultural, organizational cultural work that you need to do along the way that marries up with who you want to be as an organization moving forward. And so it shows up when people don't feel like they have agency. So you're wanting to do these inclusive kind of decision making, but they've never been able to do any decision making before, and you want them to engage in it. And the reality is they don't recognize they even have that agency to contribute to the conversation, right? And so I think that it's important that we actually take a very, very clear look at ourselves as leaders, as our organization, what is our culture, and recognize that it will come back to roost if you're doing these kind of short-term things now, but who you really are will always come back if you're not trying to change and trying to evolve. And so that notion of including our team members is utterly important, but you also should be doing some introspection to actually understand who your organization is. I do think that the notion of reentry back into a space, that we have had the opportunity to really think about space in a very different way. For many of us who were privileged to be able to work outside of our regular space and in our homes, there's a lot to learn from that. We got a lot of things accomplished, things that we didn't think. If you were one of the rigid kind of organizations or leaders who say, you have to be at your desk, you have to be there, because if you're not there, you're not working. You had to dispel that particular perspective, because work is still getting done, and it's getting done at very, very high levels. And so then you start to reconcile, do I need the space that I have? And that becomes, something that you constantly are thinking about. Then you start thinking about, of course, during the crisis, because it has these financial implications, you start thinking about, do I need all this space? Can I share space maybe with someone else? Does it make sense for me to think about space in a very different way? These are all the things that we have, in a sense, a pause to think about. But I also want to say that for those of us who are privileged and able to work from our homes, that we also have not set boundaries for ourselves either. And so the long-term implication, if we don't recognize that, in some cases, Monday through Friday for a lot of folks feels like one big long day. And our work has not necessarily figured out, we don't have that drive time. If you had drive time or something to break it up, we are working from longer days. So how do you actually think about, from a long-term perspective, if we decide that space is not as important now, the space is wide open because we can use virtual space. Now, how do we actually create boundaries so we create self-care opportunities and environment for our people and ourselves to thrive? These are things that we have to think about. Right now, it's on my mind. I haven't figured it out completely, because I am the person who Monday through Friday, and a lot of my team, it's all one big day, right? And how do we think about this notion of no boundaries anymore? Virtual space, we thought the cell phone did it, but now we have Zoom calls that do it. Now we can see you, right, all day long if we choose to do that. So I think that there's opportunities to think about all the virtual tools that we have in a way that allows for self-care to happen, to allow for people to engage, and to have us think about collaboration with other organizations to be a way to solve for not just the financial piece of it, but the cultural piece of it, and creating a center of cultural assets that actually can make maybe greater impact more than we've ever imagined.
And through the years, we've seen space evolve, and how people use space very creatively is different. It's even going to grow as we go through our next generation of whatever this new normal is. Anyone else want to add any other comments to that question? Anyone?
I would just offer. No, I was just going to offer a couple of things, Donna. I agree wholeheartedly with your point. We've been thinking seriously about our own physical space and co-locating with partners, and even our mission and vision at the beginning of the year of creating sort of equity around space by having a space that could, house some of our clients as we look at, again, the transition that occurred in the downtown with many nonprofits being forced out for a variety of reasons. But I say all that to say all of the points that you raise are incredible, especially around how we think about the traditional workday. On a personal level, I just want to share that for the first time in 3 months, I had a funder ask me literally, when does your daughter go down for a nap? Because we can schedule a meeting around that. And as I think about just even how I've had to schedule my own personal day where I'm taking meetings from 7 in the morning and my cutoff is usually around 10 or 11 because I have children running around, or maybe sending emails at midnight. So for those listening, as you're thinking about work pace, work schedule for yourself, for your team, it's disrupting the way that we've been accustomed to thinking about that 9 to 5. And again, Zoom fatigue, all of the things that this new normal, well, the norm that we're sort of acclimating to affects our ability to move our mission forward.
Thank you for that. Shamil. Kyle?
I was just going to share three quick points. Number one, we also have all of these opportunities and challenges kind of intermixed. And so teasing out the opportunities versus the challenges is the hard part. But think about this for a moment. We have spent from 1989, 1990 on forward billions of dollars trying to think about access to the workplace and how to think about inclusion, how to think about accessibility issues. Many of those now can be thought of in a totally different way. So we should put inclusion at the center of some of the rethinking of space for ourselves. The second is there's the workplace site, and then there's the work that we do with clients and customers. And I think many of our members are trying to figure out this idea of when do we convene and how do we convene, and what does that look like? And we had a number of national and state organizations cancel their conferences altogether, but get really creative about what that meant. So if some asked the registrants, would you convert your registration to a general operating gift to the organization as we think about retooling for the future? You can renegotiate in a different way with vendors and hotels and so forth. So all of those things as we think about returning back are openings for us. So rethinking convening, it doesn't all have to be face-to-face, and what are the opportunities to think differently about convening in general. And then the third thing that I think many that we're watching our members and our colleagues do is take this time to reinvent your business model. So we are often highly structured around convenings and buildings, and so I've just been having the conversation, just generally about if occupancy wasn't on your balance sheet, what would your business model look like? Not to say that you go totally virtual, but do you think differently about that now? Or do you think differently about revenue sources if you're in the midst of changing the way you work and how you support your staff? And is it a per person allowance fee structure for them to set up the office environment they need? And to your point, Donna, about creating the boundaries that they need so that they're only working maybe only a 60-hour week rather than a 90-hour week, right? So I'm not going to 40 because I'm just a taskmaster myself, but I'm just saying, how do you back off just a little bit? So changing the way we think about all those, these are opportunities that sort of sit in front of us as we think about the struggle of going back. There's just great opportunity to think differently.
Absolutely.
And I'm just going to add one other question in here very quickly. The four of you are obviously friends, and you have relationships. You can call each other. People who don't know how to do this, we're asking a lot of some leaders. We're asking about the equity. We're asking about space. We're asking about the staff. We're asking them to rethink all of their future. And I wasn't hired, or that person wasn't hired with that skill set. Where do they go to get help? How do they find some resources, someone to talk to get some assistance?
Well, I know for Michigan Nonprofit Association, this is one of those opportunities that we're providing to provide you with the space and to hear from other leaders who are, I know all of us are rendering ourselves vulnerable, saying we don't have the answers to some of these things, but we'll talk it through with you. And certainly, I know COAC, has provided that space, and I wanted to lift up the self-care series and things that they do for leaders, because we often just don't take care of ourselves as leaders and as people, period. So definitely wanted to do that. But I think that all of us provide resources that we make available at all times, whether it's through webinars, through our newsletters, through lots of calls that we'll get in the middle of the night, especially when the PPP was out and organizations are looking for support there. So I think the main message I would say, and I think I can say this on behalf of my colleagues here, is that we're all in this together, and we are also retooling ourselves in terms of how we provide that support too. And so while we have some of these things that are available now, we're also still always evaluating, how can we do more? How can we do better? What should we be changing? Be able to make those connections with leaders who want to be able to connect and get information. So I know my colleagues may have some things
So
that they
people
want
are
to share
not
as well.
alone. Folks are not alone.
Absolutely, we're
yes,
not alone.
yeah,
Exactly.
yeah,
And I
yeah,
also want to say one of the opportunities too is that, we can now be connected in so many, you can be in another country and we can connect with you just like we're connecting right now. And so I think the opportunity in terms of how we create impact and learn from others, a learning community, is much broader than Michigan. It's much broader than our country. It's a global opportunity for us to connect to. So don't want to lose sight of the implications of us all experiencing a global pandemic means that we also have the ability to connect with one another too, for solving our world's most challenging problems.
Yeah. And so many times people think that asking questions or saying that I'm afraid, or I don't have an answer, or I don't know how to do this, is more a sign of weakness, when actually it's a sign of courage. So for people listening and they need some support, just call somebody, ask. This is a challenging time. Kyle?
I just wanted to put out on the table that I never want to end a conversation like this without first off recognizing there's always power dynamics in grant maker, grant seeker relationships. And we know that, Donna, Alondra, Shamil, Paula, we've all worked in those spaces. This is the time where the reflex is to only give your funder good news and not share your struggle. And I think part of the opportunities here throughout all of this is to share with your supporters, your funders, your individual donors, your institutional donors, just things that you're doing, things that you're struggling with. Don't maybe even perhaps expect a reply, but this is not time to shelter in place and not over communicate how you're dealing with the challenges, because foundations and donors want to know what's happening and what the struggle is. They may not be able to be the first answer for relief, but sharing that, over communicating, this is the time your donors really need to know what you're doing, what you're thinking. And it doesn't have to be a solicitation, but over communication right now is actually a positive trait, not necessarily a burden to funders.
Yeah, and I would offer on the back end of that it's absolutely imperative that not only are you thinking about your business model and, as Kyle suggested, communicating directly to philanthropy, but the reality is that organizational nimbleness and the ability to pivot in this moment necessitates fiscal nimbleness. So if we're thinking through, again, all of the myriads of changes that we have to make in our organizations, and we're not having conversations with our funders and really asking questions, so not just reporting out what's working, what's not working, but asking the questions around what changes are they seeing, what ways in which their investments may be shifting in the next 6 months, 8 months, 9 months, and how that may affect our ability to pivot in this moment, I think is absolutely critical. And also the advocacy piece that I think all of our respective organizations on this phone can play in supporting that conversation and supporting that narrative is important. For me, our relationship with our philanthropic partners isn't truly a partnership, and how we articulate our needs, how we articulate the things that we're seeing in the sector, and not just for our own benefit, again, for the benefit of communities at large, is absolutely critical in this moment in time. So I would just
Thank you,
underscore
sir.
all of the points that Kyle made. And to your earlier question, Paula, I mean, all of our organizations on this call, we're here at the behest of all of your respective needs. We are nonprofit intermediaries. We are here to serve your organization. So if there are any issues, any challenges, please don't hesitate to reach out to us. And to the extent that we can meet those needs, we will. And to the extent that we can connect you to someone that can help, we absolutely will do so. That is our mission. That is the work that we love to do.
Thank you for that. A round of applause, yay, to all of our panel members. We thank you, we thank you, we thank you. And now the audience, it's your turn to ask some questions, and you'll be hearing the voice of Sarah Pender from MNA. And Sarah, do you have the first question for our panelists?
We do. We have great questions. I think we'll have time for about 3, I'm hoping, because we've got some really great questions that dig deeper into some of the things you all have been discussing. So with the talk of possibly organizations not needing office space and presumably avoiding some of these expenses, if that was to happen, how do you think these savings could go directly to employees? Maybe things like increased benefits or incentives? And taking that one step further, could we be talking seriously about that 4-day work week?
Who wants to take that one? I'm all for the 4-day work week. I got my hours in on Tuesday for a 40-hour week. Who wants to take that question? Okay, Kyle, thank you.
Well, I'll just take one crack at it. So I think one of the ways to think about this, first off, is be sure that you deeply examine what space does for your mission. So before you just say, wow, wouldn't it be great if that was no longer an expense? Be sure that that expense is unnecessary, because I don't think we should be making decisions long-term about space in the midst of a business interruption cycle. So for the next 12 months, we're going to be opening and closing, opening and closing, opening and closing. I would hate to make a permanent decision about space. So what do you do in the interim time to use some of the savings that you may have around space to invest in your staff? So is there a way to renegotiate with a lease holder about occupancy rates during an interruption cycle or an interim cycle? Or do you shift your footprint and use those savings to invest? And then I would just ask your team, what does it mean for the organization to invest in you in a virtual work environment? Because one of the things, I made some assumptions about what my team needed, but they were wrong, and they got checked after I asked. So I would just keep it circumspect first off, but then find ways to then ask your team about what investment value there is to them, as opposed to making any assumptions.
Thank you for that great question. Next question, Sarah.
Yeah, great. So this next one is also talking about space, but space in a different way, more along the topic of the racial equity and justice work. So, you know, there's a great people-centered approach that focuses on creating safe places. But we'd really like to hear some concrete suggestions on how we can create this safety, particularly in very white spaces where people focus so much on staying comfortable versus working toward progress. So we'd love to hear one or two specific suggestions from the panelists.
All right.
I'm wondering, I'm trying to understand if they meant space figuratively, the space, or did they mean it literally? I don't know what my colleagues, how they process that question.
Figuratively, Donna.
I'm sorry, I couldn't hear you.
Figuratively.
Well, you know, oh, go ahead. It's hard, but you know, my first inclination to hearing that and understanding as being figuratively in terms of space and the notion of as they described white colleagues wanting to be comfortable, it just to me goes right back to culture, organizational culture. And we try to ignore that as being something that is really the foundational piece for creating that space. And so the notion of having a culture of being, uncomfortable and creating that opportunity to be uncomfortable and having an inclusive conversation around, you know what, we're going to decide as an organization that we're going to create space to be uncomfortable. And what does that mean? And how can we advance that as a philosophy in terms of who we want to be? So I always go back to the culture, because many of these things can either be very temporal if you don't deal with the foundational piece, which I think is the ability to look at your culture to create that space. And the reality of it is, a lot of us haven't had the opportunity to deal with some of these conversations that are coming up right now. And so all of it is uncomfortable for everybody. And so while we're talking about, while we're talking about, the white people in this case, as the question was presented, being uncomfortable, I'll admit that it's quite uncomfortable for me as a Black leader, Black woman leader in an organization that's predominantly white, and trying to figure out how to balance that. And so I think there's a lot of pieces about being uncomfortable, but the sense of creating and stating that we are going to be uncomfortable and we're going to hold that up as a value of how we actually work through this is the beginning phase for everybody being able to contribute to that. So not looking at it as who's uncomfortable, because I can tell you, no matter where you are in the continuum of that conversation, somebody is going to be uncomfortable along the way. And so if you recognize that and lead with that as an opportunity to create the safe space, I think that's a concrete opportunity or place to start. That's what
I appreciate you saying that, Donna, because
thank you for that. It's very quickly
to know that there may be uncomfortability as it relates to engaging in conversations specifically, and explicitly around race, but there's also huge discomfort, especially for people of color who've been forced to be silent on issues of race in settings that are largely predominantly white settings. So I think engaging in the conversation and having sort of the bold first step to enter into that arena, to me, has to be grounded in your organizational values, and really looking at what are our organizational values? What are my personal values as a leader? How are we having those conversations with our board? How have we articulated them, expressly in terms of how we breathe life into that as it relates to our mission, and then figure out, okay, how are we thinking about engaging in those conversations? But to me, it starts with introspection and having clear articulated values that say that this is important to us. Having conversations around race, having conversations around inequity, grappling what equity looks like in this context around us is important. And we're willing to do the work, even if it's tough for some in this moment.
Thank you for that feedback.
Conversations as I'm sorry, moderator. My apologies.
Very quickly, because we're a little bit over time now.
I was just going to say conversations are great, but conversations without purposeful action connected to them, that's what you want to make sure happens. Like it's purposeful.
This is such a powerful conversation. We should go at least till 3. Everyone on the call, do you want to just stretch this out a little bit till 3 o'clock or 4 o'clock?
It's Juneteenth. We can't stay all day.
That's right. We have celebrating to do.
It's informative, it's therapeutic, and it's outstanding. Sarah, do you want to try for one more, or you want to wrap it up here?
Sure. So I'll throw this one out there. It might not have time for everyone to respond, but keep in mind it's our first of many in this series, so we'll have lots of time to talk about these topics. The question is, what are your organizations doing to help nonprofits explore strategic alignments and/or partnerships?
Go back to partnerships again. You can't do much without partnerships. So who wants to take that question?
So I'll start. One thing that we are in the midst of right now, so we have a program called the Activate Fund. It's a $1.5 million fund to support nonprofit capacity building and collaboration. Through that fund, we are piloting a collaboration pilot where we are incentivizing and providing resources for collaboratives, either pre-existing or newly emerging due to some of the crises that we are experiencing, to be able to collaborate. So providing them with the tools, providing them with facilitators, whatever it is that they might need to be able to think about how their work aligns and how they move that work forward. So that's one piece at COAC that we're doing.
Great, thank you for that. And to all of our panelists, thank you so much. I'm so encouraged and inspired. I meant that when I said I could just listen to you talk all day long. And for the work that you do and the people that you serve, it's not just a job. It's never been a job for you. It's a way of life. It's a mission. It's a purpose. And it's a purpose-driven work that you're doing. So thank you very much. We're going to now turn this over to Shamil. And Shamil, you're going to introduce the final presenter. Thank you.
Thank you, Paula. So for over 21 years, MCR's ongoing mission has included providing access to pro bono legal services and other trusted guidance to help nonprofits serving low-income communities to advance their missions. We recognize that people from undeserved and marginalized communities face an access gap to resources like adequate healthcare, economic support, and more. And as we illuminated on this call, even the governor touched on this, COVID-19 has only widened that gap. The needs of the most vulnerable, particularly for grassroots organizations led by Brown and Black people, are great. Access and connection to quality transactional legal services are critical. Therefore, in this moment in time, we have reaffirmed our commitment to the work, and indeed, COVID-19 and the deep history of institutional racism that plagues our society has shown us that we all, and when I say we all of us on this call, we have a moral imperative to distribute resources more equitably. By offering meaningful pro bono legal services, we know that we can do this in solidarity to create a more inclusive and equitable future for those nonprofits and communities. To do this important work, MCR leverages the support of volunteer lawyers and law firms throughout Michigan. This webinar series will include these lawyers serving the greater nonprofit community, helping our greater community to be informed and stronger. So we hope that you can return back for future webinars, all while demonstrating the commitment to the Michigan Bar Association and pro bono service. So with that said, today we are pleased to welcome Courtney Kissel, a partner in the Government Policy and Practice Group at Dykema Gossett. Courtney attended the University of Michigan for her undergraduate degree and the University of Wisconsin for law school. Her practice primarily focuses on issues surrounding state government and state regulation, including state constitutional law, educational law, election law, and energy law. In addition, Courtney is significantly involved in her firm's appellate practice. Courtney has been hired to advise state executive officials in several states, including Wisconsin and Indiana, on a variety of issues, and has also been appointed as Special Assistant Attorney General in Michigan on a number of regulatory issues. So Courtney, thank you for joining us, and I'll turn it over to you.
Thank you so much, Shamil. I appreciate it. And good afternoon, everyone. Thank you so much for having me. The legal obligations of employers and the regulatory structures in which you guys exist have always been quite complicated, and that has never been more true right now. We are living through a very unique time and very unique regulatory structures in particular that are changing, if not on a daily basis, then sometimes a weekly basis. So I just wanted to give you a very high level overview on a number of different issues. And if you want to flip to the next slide, I'll show you our tentative agenda for today. I want to warn you up front, I'm going to throw a lot of information at you. I'm going to keep it at a pretty high level so that we have time to go over the basic framework of some of these issues that we're facing, as well as leave time for some Q&A and give you a number of different resources that you can look at. So we're going to briefly touch on the current legal landscape. I'm going to talk very, very briefly about the federal and the local level. Our conversation is going to mostly focus on the state law, state executive orders. I'm going to give you a current brief update of the executive orders on reopening as they stand, at least before we joined this call today. The workplace safety requirements that the governor has put into place that she mentioned this morning, as well as discuss compliance and penalties for non-compliance for everyone, and then go into some resources. So on the next slide, I'm just going to, again, briefly touch on these layers of regulation. So at the federal level, and you'll see on the next slide, we don't have to move to it yet, but then the federal level, there has not been much mandatory guidance put in place. Everything has sort of been on a recommended level. The state is where we found most of our regulation. And then we do have local executive orders and local public health orders that have also been put in place in some locations. And for those of you who have organizations that are in multiple locations, the end result can be a very complicated, complex regulatory landscape for you to navigate, particularly because it's ever evolving and changing. So it's important to know where to look, which is sort of what I'm going to focus on. So the next slide touches briefly on the federal guidance. Federal guidance is coming from several places. OSHA and the CDC are the most significant with respect to reopening. There's a couple documents here on the screen. There's some resources at the end that I'll point you to for those two entities. The White House also has some guidance as well, but OSHA and the CDC are really the most significant for you to know about. But moving on now to the state level, which I think is going to be what everyone really wants to talk about. Currently, executive orders number one, I'm going to shorthand them here, 110, 114, and 115 are likely to be the most important for you to review as you consider your obligations moving forward as you resume in-person activities, or whether you choose not to at this time. I just want to note for you that the governor has suggested that she will be opening additional regions and/or businesses in the coming days, so these numbers may change. There is a link I've included in the presentation to the executive orders. They're listed all in numerical order, so you'll be able to find them relatively quickly. So just keep in mind that these numbers might change even after this call. So as many of you probably already know, the governor has taken a regional approach to reopening. So regions 6 and 8, which is all of the Upper Peninsula and over a dozen counties in the northern Lower Peninsula, most but not all businesses or operations have been able to reopen if they chose to do so, subject to certain restrictions. We're going to talk a little bit more about the restrictions, but just to give you a highlight for regions 6 and 8, every business that reopens, public, private, profit, nonprofit, is subject to Executive Order 114. And the governor mentioned that this morning. That is the workplace safety executive order. And I'm going to go in a little bit more detail on that, but that is a very important executive order for you to be aware of. There are also industry-specific restrictions in some of these executive orders. So 115 is the EO that's specific to Region 6 and 8. And there are some additional industry-specific regulations in that EO that you would want to be aware of if you're in one of those regions. The rest of us in Michigan, however, there are still additional restrictions on gatherings and who can reopen. We're going to talk a little bit about that on the next slide, but you're going to want to also review any executive order that may apply specifically to your industry. So I know we have a wide variety of nonprofit organizations that are represented here today. Executive Order 110 and 115 are more generic in nature. There are specific executive orders for childcare organizations, long-term healthcare organizations, healthcare facilities. So you want to also make sure that you are reviewing any executive order that may apply to your specific industry in addition to these general executive orders. If you could go to the next slide, please. So I think a lot of the questions I've received are, who can resume in-person activities? We've obviously shifted from what was the stay home, stay safe orders, from who can be open, to now we've shifted to who has to stay closed. So it's a much broader list of who can reopen. But what's important to remember is no one is required to reopen at this time. You want to evaluate your own obligations, as well as how comfortable and how much your business or operations are ready to reopen. So no one is required to reopen, and that I think is important to remember. And even if you can or decide to reopen, you want to keep in mind the following things. Telework is still required where possible. So any work that can be done remotely outside of region 6 and 8 is supposed to be done, actually it says must be done remotely. In region 6 and 8, that language has lessened a little bit, and it should be done remotely. So the governor is still encouraging as many people who can stay home to stay home, to keep our numbers in the direction that they're going. You also want to make sure that you understand what your workplace safety requirements are as you move forward, and to remember you may need to look, even if you aren't located in multiple jurisdictions, there are multiple places that you're going to want to look. But if you are located in multiple jurisdictions, it can be a very complicated, sometimes inconsistent, although in Michigan, I would say we are on track to be more consistent than other places. But you also want to check any local orders, which I'm going to talk about, and any administrative orders, depending on the type of business that you're in. So the next slide, we'll talk about a hypothetical, just to give you a very basic idea of where you want to start looking for things. So if you're an office-based nonprofit operation located in Lansing, Michigan, where would you even start? I think you would want to look for, again, this is the caveat being, if you have some sort of industry-specific executive order, you're also going to need to look for those. But just in general, Executive Order 110 is going to be your applicable reopening order. You're going to want to look at 114, which is the workplace safety order. Executive Order 36 is the worker protection order. That order is also referenced in 114 as one of the requirements you have to follow. You're going to want to look at Ingham County emergency orders, City of Lansing orders, as well as CDC and OSHA guidance. So that's, I know that's a lot, but that is the first places you want to look. And there may be additional items you need to look at as well, depending on your specific organization. So the next slide has just a quick note for you. There have been several challenges to the governor's authority to issue executive orders restricting business operations and workplace safety requirements. As of today, the Michigan Court of Claims has ruled that the governor has broad authority under one of the two statutes that she has been using to issue these orders. The other has been restricted. Again, that case was with the Michigan Court of Claims that is now going before the Michigan Court of Appeals, and then to the Michigan Supreme Court. A federal court has sent 2 certified questions about the governor's authority to issue these orders to the Michigan Supreme Court just this week. So we may see some sort of resolution or some sort of opinion out of the Michigan Supreme Court sooner rather than later. But as of right now, the governor has broad authority to issue these executive orders. So it looks like for at least the near future, we will be sort of living in this sort of new environment with respect to regulation. Next slide, please. So as I mentioned before, local orders. We have seen a shift since the phased reopening has begun. The local orders have been mostly rescinded at this point. I believe Ingham County has an executive order that's still active, but it's not nearly restrictive as it used to be. Wayne County, Oakland County had public health orders that were also active and restricted additional business activities. Those have since been rescinded, but it's something you want to pay attention to, especially going forward, depending on how the governor's authority is or not restricted. Next slide, please. So workplace safety requirements, and you can go on right to the next slide too. There is Executive Order 114. The governor has put in place a number of workplace safety requirements that need to be followed as you reopen. So for all businesses and operations, there are at a minimum 18 specific requirements that you have to have in place as you reopen. I'm going to touch on just a few, just the highlights. So just keep in mind that there are a lot of additional requirements that you will need to take a look at. But you have to develop a COVID-19 preparedness and response plan. I'm going to talk about that on the next slide, but that's important to know. It needs to be in place within 2 weeks of reopening. So for those of you who have organizations that have been operating, you want to make sure you have your COVID-19 preparedness and response plan in place. It's been a requirement, I want to say, in the last at least 3 executive orders that deal with business operations. So you want to make sure you have your plan in place, and we will talk a little bit more about that. You need to provide specific training to employees on the specified topics in the EO. You need to conduct a daily entry self-screening protocol for all employees and contractors entering the workplace. You need to provide non-medical grade face coverings and require face coverings to be worn when social distancing cannot be maintained. And you need to provide notification of a confirmed case of COVID in your workplace immediately to local health departments and within 24 hours to coworkers, contractors, or suppliers who may have come into contact with the person. So again, those are just the highlights. The COVID-19 preparedness and response plan is, and the governor mentioned this morning, it's based on the guidance on preparing workplaces for COVID-19 that's developed by OSHA. And there's a link in this presentation to that document, as well as a link in the EO. And what that does is it basically requires you to classify your employees by risk level. And OSHA provides a number of different recommended actions for those different risk levels. There are templates available in a number of different locations. I just want to caution everyone that when you find a template, you want to make sure that you tailor it to your operations. You need to look at your employees and classify them and your physical space and see what you need to do to correspond to the different risk levels in your workplace. MyOSHA has a template document for lower and medium risk level employees that I link in the presentation. That is a great resource. And I think for most of the people on this call, your employee, 80, 90, maybe higher % of you have only low and medium risk employees. So that might be a great starting point for you. And remember, just to make sure that you tailor it as needed. Another place to look is your local health department or your local, just your county. Some of them also have templates for you to follow. So the next slide, I'm not going to go through all of one. We're not going to be, you guys don't want to be here all day. And I think Executive Order 114 has about 15 pages worth of requirements, so I won't go through all of them. But I just want to note for you that it is broken down by industry specific requirements. So you have the 18 that apply to everyone, and then it's sort of broken down by different industries. Most notably for most of you, I'm sure on the call, there is an office space restriction. So there are a number of requirements that you have to implement, even if you just have an office, as opposed to being in construction or manufacturing or a research laboratory. So you want to go through EO 114 to make sure that you can sort of check the list that you have everything you need as you reopen. You also want to make sure that there are no other requirements in any other relevant EO for you. So again, just going back to if you are a food selling establishment or a pharmacy related entity, there may be other specific requirements that you need to implement in a different EO beyond 114. So the other thing I wanted to note for everyone is 114 does require you as an employer to maintain records on 3 things: the required training that you have to give to your employees under the EO, the daily entry self-screening protocol, and any required notifications that you have for any confirmed cases. Next slide, please. So the biggest question I get, and I'm sure all of you have, is how am I supposed to comply with all of these? How am I supposed to keep track of all of this? And there's a lot. It's a big change. And I think that the good news is we have everyone is in the same place. And while it may seem like the second you're in compliance, you're out of compliance, I think that we are all we're all in the same place, and you want to make sure that you are just keeping on top of everything as much as you can. And I think that comes down to checking executive orders in local jurisdictions and just using your best efforts to do so. The penalty for violating these EOs is a willful violation of the EO can be found to be a misdemeanor, which can carry a $500 fine and up to 90 days in jail. That said, we have not seen much of that level of enforcement, right? We haven't seen anyone thrown in jail for non-compliance. But we have seen, I'm sure many of you have heard about on the call, the Owasso barber who opened despite a executive order prohibiting him from operating. His license was taken away for a period of time, although this week it was reinstated. But that is another possible penalty for you if you have any licenses that you are holding. That could be an issue. I do think that now that we're moving away from the sort of initial short-term response and more to the long-term response, there may be more enforcement, but we haven't seen a whole lot of that at this point. I would also just note for you that the governor in EO 114 structured the penalties a little differently, and she had it structured so that it would be a violation of MIOSHA if you don't comply with the EO. We've had a court of, again, the Court of Claims has held just probably about 2 weeks ago now that the way that was structured in the EO was not permitted, and so the Court of Claims has struck that provision at this time, but we're not sure what any appeal will look like on that. So I just wanted to highlight that for people. We could go to the next slide, please. So I've thrown a ton of information in a very short period of time to you. So I want to talk about, answer any questions that anyone has, but there's just a couple of things I want to mention to wind up. I know I've given some people some not so great news in that there are a lot of new and changing requirements. And I know I hear this on a daily basis, that it's frustrating and overwhelming for people. I think the thing to keep in mind is something the governor said today, which is, all of these regulations and restrictions may seem overwhelming and may seem burdensome at some level, but it's really about trying to keep everybody safe and trying to keep from having to, to have any more stay-at-home orders, keep your employees safe as well. So that's the goal, and I think that when you keep that in mind, it's a little bit easier to digest. I also want to say, the other good news is you don't have to reopen if you're not ready. You need to not only evaluate your legal obligations, but all the other obligations that were so beautifully discussed earlier in the different panels. You want to consider all of that as you move forward. As I mentioned before, everyone's in the same place, and every day brings new issues, not only in a legal way, but in a number of different ways, and there are a lot of opportunities to have as you are looking at your operations, looking at your bylaws and your articles to make sure that you are flexible in how you're responding and complying with all of these new requirements that we have. Finally, there are a lot of, now that we're in the more long-term response, there are a number of places to find great resources. And so in this series is one of them. This is a fantastic opportunity for people to sort of share their knowledge and their resources together. And I think that is going to be a great resource as you guys go forward. So I just want to highlight for a few specific resources for you that are on the screen here. I'm sure most of you have visited the Michigan Coronavirus homepage, but there are a ton of links on there that it's really easily accessible, so you can find the most up-to-date information. There's a link to the executive order, so you can find those quickly. A lot of them have FAQs attached to them that can be helpful for you. The Michigan Department of Labor and Economic Opportunity has a great reopening website. So there are, it's broken down by industry. There's a reopening checklist that I link here. It has that template that I talked about. That's all available on that link. I'm also just including for you the links to the CDC's guidance on businesses and reopening, as well as the OSHA guidance on returning to work and OSHA guidance on preparing the workplace. Those are all great resources, as well as everyone on this call sort of pooling resources. I think that, you'll be able to find that as we enter this long-term phase, more and more resources are available. I know, for example, Oakland County is handing out reopening kits to businesses in the county. So there are lots of new places to look for resources. So with that, I just wanted to thank you all for this opportunity to talk to you. Keep in mind that there are a number of issues that I barely scratched the surface on, but that you will be able to sort of dig deeper on as this series goes forward. But with that, thank you. And if anyone has any questions, I'm happy to answer any.
So I just want to reiterate a thanks from all of us, Courtney. This is Shamil for those that cannot see me. So much good information, and we are fortunate to partner with you and other firms through our pro bono partnership. I would encourage everyone to look at the resources that Courtney lifted up. And just as a quick note, MCR is hosting a legal clinic, which we will continue through the next few months for access to attorneys like Courtney to help through issues with things like reentry loans and grants. But again, a reminder to everyone, I know it feels overwhelming in the moment, but again, this is just an opportunity to help ground all of you in some essential resources and tools. And you have amazing partners like those on this call that can help navigate. So with that, I'm going to invite Sarah Pinder from M&A to join us back so that we can have Courtney answer any of your questions.
Thank you, Shamil, and thank you, Courtney. We do have some great questions coming in, so let's jump right in. The first one is from Linda. She's wondering if you recommend liability waivers for certain situations. For example, congregate dining sites at senior centers.
That's a great question. I think I'll say a couple of things on that. One is I think you do have to look at your particular business and look at what your liability could be. There's a lot of question right now, just given the uncertainty on what we're dealing with on how effective liability waivers are. Now, that doesn't mean that you don't want to have one to sort of preemptively protect yourself as much as you can, but there is some question about how effective some of those will be. I would just note that on the liability front, there are efforts at the federal and state level to sort of look at how employers are going to be liable and maybe either help with the impact of liability or not. So I think that there may be some legislation coming that may also sort of sway the decision on that. But I think at this point, you probably want to talk to your your in-house counsel or your outside counsel to see if that really makes sense for your particular business. But I've seen them done on in a number of different industries, but I do know that there is some question about how effective some of those will be going forward.
Yeah, thank you. So this next question is actually also in that vein of liability. So what is a nonprofit's responsibility or liability if volunteer committees are meeting in person? For instance, this organization has a committee that's all in the same general geographic region, so they're meeting, but they're keeping it outdoors, maintaining social distance, under the maximum numbers of people that are recommended. So talk about liability maybe in that situation.
So to me, that sounds like it shouldn't be a problem, at least how I think it was described, right? Remember that the liability under the EOs is for willful violations. So, I think in that case, especially if it's being done appropriately and within the regulatory framework of social distancing and things like that, you might not have much liability at all. But I do think it's important to remember that from the employer standpoint, that you have the policies and procedures in place where you are letting your employees and your volunteers know, here's what we are requiring of you. And if you are finding out that people aren't complying with those orders, to take the next step to reiterate, here's what the rules are. The most common I hear is, I know we are supposed to be requiring face coverings in shared spaces, but our employees don't want to wear them. Well, the EO doesn't require you necessarily to go out and enforce it strictly every single day and, to track down those who are violating it and fire them. But it does require you to provide a safe workspace. So I think there's a lot of balancing, a lot of competing interests, but as the employer, you want to make sure that you are making clear what your expectations are and making sure that those are aligned with the requirements under any EO or local order that you have to comply with.
Great, thank you. So again, I think we're in this vein of liability. We can see where people's concerns are, and rightfully so. As you mentioned, there's lots to know and still a lot coming to the forefront and being interpreted. So do you have any advice for organizations and organization leaders if their services are being hosted by another nonprofit? So if a nonprofit has staff and clients, but they're actually going to someone else's office to provide those services.
So I would say that you would want to look closely at some of these executive orders to make sure that you are still complying. So not only do these executive orders address your own physical workspace, but for those who provide in-person services to others, that there's also separate EOs that relate to that. So it might not even be necessarily, hey, we don't have employees in our workspace, so we don't have to worry about it. If you are requiring your your employees to leave their house to go to work, the EOs apply to you, right? So any workplace safety requirement, it kicks in when you say, hey, you as my employee, here's what you need to do. And if it requires them to leave their home, then these EOs apply. So I think keep that in mind and look at what requirements do you really need to be concerned about, and make sure that your policies and your COVID response plan is ready to go, and that your employees know what's expected of them and what you expect as the employer, and what you what they have to do as wherever they are located.
Great, thanks. So are employers required to provide liability for remote workers?
I'm not sure what you mean.
Yeah, and I'm not entirely sure either. And Joni, if you're still on the call and you want to add a little explanation there, we'd be happy to pose your question again. Make sure that we're, playing this game of telephone, that we're getting the right question in and answered. Speaking of liability, Courtney, what things should people be considering, or is there liability on the organizations who might be reopening to the public that goes past, keeping their staff safe and such, but also the people they serve?
Yeah, so the executive orders also touch on those. So if you have, if you are front facing, if you have retail customers or you have customers coming in, there are restrictions. Again, it's industry specific, it's broken down in the EO, but there are things that you need to do. A lot of them are sort of common sense. There are things like having markings for customers, again, depending on the industry, having certain hours for vulnerable populations to be in, with respect to your COVID preparedness response plan, for employees that deal with the public on a regular basis, there are things recommended like, physical barriers, like plastic barriers for, so that there's some additional barrier between the customer and your employee. So there are additional requirements that you're going to want to think about beyond just, hey, we're in our office with our regular staff. If you have people coming in, there are additional things that you're going to want to do to make sure that you're keeping not only them safe, but your staff safe as well.
Thanks, that's great. And so I did get some clarity from Joni on her question. So I'll pose that one, and that will be our last of the audience questions for today. So if an employee is required to work from home, does the organization have to provide liability insurance for their home workspace?
That's a good question. I haven't really thought a whole lot about that. I think that would depend on what you as an employer are currently doing, and look at your policies to see if that's required. I'm not generally aware of that requirement, but you know, if that's something that your sort of articles or bylaws or original policies contemplate, then you will want to continue doing that. But I would take a good look at what you are required to do currently, and see if you think you need to continue that.
Thanks so much, Courtney. I'm now going to turn it back over, I believe, to Shamil, and we're going to go forward here.
All right. Well, thanks, Sarah. And thanks again, Courtney. I appreciate all of the insight. And I think, you know, just to wrap up all of the points, including the ones that Courtney lifted up for everyone on the call, plan within your means and with purpose. You know, garner the resources that are available, especially connecting to organizations like the ones on this call, M&A, MCR, COACT, and other nonprofit intermediaries. Most importantly, center your people and community in reentry. And as Courtney said, you know, think about the timing of that. Have it make sense for your particular organization. As Kyle lifted up, communicate and advocate with your funders, and rethink how your workday and work week feels. But most importantly, reassess your values and breathe. This is a time where we all need to breathe and remember that, again, we're doing this at the behest of our communities that we serve. And we are all doing incredible work. So we appreciate all of you. And with that, I'll turn it to Donna.
Yeah, well, thank you, Shamil. Wow, this has been a fantastic kickoff session to the New Way Forward, Reimagining the Nonprofit Workplace series. Please note again, this is a kickoff. We know that there were a lot of great questions, and yet we encourage you to stay connected to our future sessions that are planned to go deeper on philosophical and tactical aspects of workforce reentry. Also, I want to remind you that the handouts that were referenced by Courtney during her presentation are accessible in the webinar control panel. We would like to thank all of you for participating and ask that you help us to continue to serve you best. So please complete the evaluation at the end of the webinar. It only takes a couple minutes and it will be invaluable to the planning team as they develop future sessions and content. Speaking for future sessions, please join us and register for the sessions on your screen, as well as additional ones that will be promoted in the future. Thank you for joining us, and have a great weekend and happy Juneteenth Day.